History is rarely a lie of invention. More often, it is a lie of omission. It exists in the blank spaces of a ledger, in the skipped lines of a government document, in the quiet erasure of a community that was there one day and legally vanished the next. If you were to look at the official archives of the 1,895 state census for the northern timber districts, you would see a portrait of absolute prosperity. You would see page after page of elegant, sweeping cursive, documenting a booming population of mill workers, foremen, and merchants. The ledgers describe a rapidly expanding industrial frontier, humming with the machinery of the Gilded Age. To the federal health inspectors who later relied on this data to map the spread of disease across the country, the region appeared remarkably robust, completely untouched by the epidemics ravaging the more crowded eastern cities. But when modern archivists began cross-referencing those exact census sheets with the private diaries of local physicians and the quiet expansion of unmarked parish graveyards, a chilling anomaly emerged. Entire blocks of boarding houses, home to hundreds of transient workers, had been completely excluded from the count. And that was only the beginning of the inconsistencies. The year 1895 was a volatile time for public health in America. Rapid industrialization had pushed thousands of workers into tightly packed, hastily constructed settlements. Clean water was a luxury, and sanitation was an afterthought. Between the decennial federal censuses, many rapidly growing states conducted their own midway population counts in years ending in 5. These state censuses were not merely administrative exercises, they were the lifeblood of a town's survival. A rising population guaranteed continued railroad access, lucrative timber contracts, and vital state funding. A declining population, or worse, a quarantined one, meant sudden and irreversible economic death. In the early spring of that year, the ice began to thaw along the logging routes, flooding the lower basins of the timber settlements. With the meltwater came something else. At first, it was dismissed as a routine seasonal ailment. Local records suggest that foremen logged an increase in absenteeism, attributing it to what they called winter fever or camp lung. Men were experiencing high temperatures, severe lethargy, and a dark, telltale rash on their abdomens. The local authorities did not declare a public emergency. Instead, the sick were quietly moved out of the main work camps and relocated to the densely packed boarding houses on the edge of the district, near the stagnant waters of the lower mill pond. It was an isolation of convenience, designed to keep the mills running at maximum capacity. And that is when the narrative recorded in the official ledgers began to diverge sharply from reality. By May of 1895, a highly localized but incredibly virulent outbreak of what was likely typhoid fever had taken hold of the lower district. Dr. Arthur Vance, one of the few private physicians operating in the area, noted a sudden, terrifying surge of mortality in his personal letters. He described rooms where entire families were too weak to call for water. He wrote to a colleague in a neighboring county, pleading for clean linens and quinine, explicitly stating that the local authorities were ignoring his requests. Yet, when federal health inspectors later surveyed the region's mortality schedules to track the national spread of enteric diseases, Vance's alarming figures were nowhere to be found. The official death toll for the entire district in the spring of 1895 was listed as a mere 12 individuals, none of whom were recorded as dying from infectious disease. What the federal inspectors found instead changed the narrative entirely. In June of 1895, the state dispatched enumerators to begin the house-to-house census. These men carried heavy canvas binders filled with large, grid-lined sheets. Their job was to document every living soul, noting their age, occupation, and place of birth. When examining the surviving physical documents from the lower district today, The visual evidence is immediately striking. The first several dozen pages are immaculate. The ink is dark and steady, the columns perfectly aligned. The enumerator meticulously recorded the households of the mill owners, the merchants on the high street, and the foremen in the upper camps. But as the route progresses toward the lower mill pond, the epicenter of the boarding houses, the physical quality of the documents begins to deteriorate. There are abrupt changes in the handwriting. There are vast, unexplained gaps in the residential addresses. In one striking example, the enumerator's log jumps from house number 402 directly to house number 418. The 15 boarding houses that sat between them buildings, known to have housed upwards of 200 immigrant workers, are simply missing from the record. Some historians believe the enumerators were explicitly instructed by local politicians to bypass these infected areas, ensuring the town's population appeared healthy enough to secure a pending railway expansion. Others suggest the enumerators themselves were simply too terrified of the sickness to knock on the doors, choosing to invent a few scattered names from a safe distance rather than risk entering the quarantine zone. But what happened next remains unclear, because the physical evidence left behind on the census pages points to something far more deliberate than mere fear. If you look closely at the margins of page 47, under the harsh light of a modern archival scanner, you can see the faint, ghostly indentations of a pencil beneath the heavy black ink. The enumerator had originally written down the correct, much lower population tally for that specific ward, accounting for the sudden wave of deaths. But someone had come behind him, meticulously erasing the pencil marks and writing over them in ink. They didn't just hide the dead, they fabricated the living. Fictional families, with common names and standard occupations, were written into the ledger to fill the mathematical void left by the outbreak. It was a statistical ghost town, built to deceive anyone who looked at the numbers from a distance. But the illusion was incredibly fragile, and it was only a matter of time before the federal inspectors, sitting in an office hundreds of miles away, noticed the one minor mathematical error the local authorities had forgotten to hide. The federal health inspectors of the late 19th century were not detectives, but they were meticulous statisticians. Working out of cramped, gaslit offices in the capital, their primary tool for tracking the invisible spread of disease was demographic consistency. They cross-referenced state population counts with national mortality schedules to draw epidemiological maps of the country. And when an inspector named Thomas Reed began reviewing the state records for the northern timber districts in late August of 1895, a peculiar demographic anomaly caught his attention. It was an issue of age and occupation. According to the freshly inked pages of the state census, the lower Mill Pond district had experienced a sudden, inexplicable surge of able-bodied men between the ages of 20 and 35. On paper, there were no infants, no elderly, and almost no women recorded in the newly populated boarding houses. Furthermore, dozens of these fabricated workers were listed as coopers, barrel makers, an occupation that had been largely obsolete in that specific district for over a decade due to changes in how the timber was transported. The local enumerators, in their rush to invent a healthy, thriving populace to replace the dead and dying, had relied on outdated templates. They had populated their ghost town with phantoms of a bygone industry. But that wasn't the strangest part of the official record. When Inspector Reed calculated the ratio of living residents to the town's reported agricultural output and supply imports, the numbers simply did not align. A population of that size, performing heavy industrial labor, required massive trackable shipments of grain, salted meat, and fuel. Yet the railway freight logs from that summer, preserved in separate interstate commerce archives, showed a severe drop in supply deliveries to the town. You could not sustain the booming population listed in the census with the dwindling food shipments recorded by the trains. The town was starving on paper, even as it claimed to be growing. While the federal inspectors were slowly uncovering this bureaucratic, impossible reality from afar, The situation on the ground was rapidly deteriorating. Surviving documents from those living on the periphery of the quarantine zone provide a harrowing glimpse into what happens when a community is erased from the map. A series of letters written by Clara Hewitt, the matron of a boarding house just outside the lower district, offers a deeply personal counter-narrative to the pristine government ledgers. Her correspondence to her sister, now preserved in a university archive, describes a suffocating atmosphere of secrecy. She wrote of men leaving for their mill shifts and simply never returning. She described how the town constables had quietly cordoned off the roads leading to the lower pond, turning away anyone trying to bring food or medicine to the infected workers. Perhaps most chillingly, Hewitt's letters describe the sounds of the night. With the official mortality schedules claiming no one was dying, the dead had to be disposed of outside the view of the general public and outside the official registry of the local churches. And that is when the physical landscape itself began to betray the town's secret. Modern ground-penetrating radar, utilized by historical surveyors decades later, revealed the true cost of the 1,895 cover-up just beyond the tree line, a mile south of the main municipal cemetery, lies a series of long, unmarked trench burials. The private ledger of a local undertaker named Elias Thorne, discovered in an attic in the 1970s, contains cryptic, uninvoiced entries from May to July of 1,895. Thorne simply marked tally lines under the heading Night Transport. There are no names. There are no dates of birth. There are some like 142 stark, vertical lines drawn in black ink, representing an entire sub-community that was quietly buried under the cover of darkness. Because the town's leadership had successfully hidden the outbreak from the state and federal governments, no medical relief was ever dispatched. No clean water initiatives were funded. The federal quarantine protocols that could have brought tents, doctors, and sanitary supplies were never triggered. The deception, originally designed to protect the town's economic standing, had actively condemned the infected to a slow, unacknowledged end. What they did not anticipate was that their economic ambitions would ultimately be the catalyst for their exposure. By early September, the long-awaited railway executives arrived in the upper town. They had seen the glowing census reports and were prepared to finalize the expansion of a new freight line, a project that would secure the town's wealth for a generation. The local politicians hosted lavish dinners, ensuring the executives were kept far away from the stagnant air of the lower basin. But records suggest the illusion was already fracturing. The timber mills, severely understaffed due to the hidden fatalities, were failing to meet their production quotas. The foremen were forced to run the machinery with exhausted, inexperienced crews, leading to a string of documented industrial accidents. The railway executives began to ask questions. Why were the mills so quiet? Where were the hundreds of robust laborers promised by the state census? There is no clear consensus on what exactly triggered Inspector Reed's sudden deployment to the region. Some historians believe the railway executives themselves sent a telegram to the capital, suspicious of the empty streets and the smell of carbolic acid that occasionally drifted up from the lower basin on the evening wind. Others argue that Reed, haunted by the mathematical impossibilities of the barrel makers and the missing grain shipments, authorized his own field investigation. Whatever the catalyst, on the morning of September 14th, 1895, Inspector Reed stepped off a passenger train onto the wooden platform of the Northern Timber District. He carried with him a leather satchel containing the official census ledgers, a blank notebook, and the authority of the federal government. He was greeted by the town's mayor, who offered him a curated tour of the bustling high street and the pristine upper camps. Reed politely declined. He opened his ledger, pointed a gloved finger to a page, listing 200 able-bodied men living in the boarding houses of the lower mill pond, and requested to be taken there immediately. What Inspector Reed found when he finally crossed the barricades into the lower district would change the federal approach to public health forever. The descent into the lower Mill Pond district was a descent into an abandoned world. As Inspector Reed walked past the perimeter cordons, the noise of the upper town faded, replaced by an unsettling stillness. He carried his leather-bound census ledger, ready to match the names on the pristine pages to the faces of the residents. But there was no one to match them to. The boarding houses, structures listed on paper, as teeming with young industrious laborers, stood largely empty, doors swung loosely on their hinges. In the courtyards between the buildings, where the census claimed hundreds of men were living and working, Reed found only scattered debris and the lingering acrid smell of burnt sulfur, a rudimentary and desperate method used to fumigate infected air. Reed's field notes from that day, preserved in the National Archives, are remarkably stoic, yet they betray a profound shock at the scale of the deception. He systematically moved from house to house. At house number 418, he recorded, property entirely vacant, bedding soiled and abandoned, no signs of recent habitation. At house number 420, he found a handful of survivors, mostly older men, emaciated and fearful, who spoke little English. When Reed asked them through a translator about the vibrant, bustling community of young Coopers listed in his ledger, they simply shook their heads. The fabrication was total. Reed quickly realized he was not merely looking at an inaccurate count, he was standing at the scene of an institutional crime. The confrontation that followed was swift and remarkably quiet. There were no dramatic arrests in the town square. In the late 19th century, the jurisdictional lines between state and federal authority regarding public health were still incredibly blurry. The federal government had the power to monitor and report, but punishing a town for lying on a state-administered census was a legally complex endeavor. Instead, the consequences unfolded through the slow, crushing mechanisms of bureaucracy. Reed returned to the capital and filed an immediate injunction against the town's census data. The report he submitted was devastating. He detailed the fabricated names, the missing supply lines, the vacant houses, and crucially, he included the frantic correspondence he eventually uncovered from Dr. Arthur Vance. Within weeks, the narrative of the booming, prosperous timber district collapsed. The railway executives, upon reading a preliminary summary of Reed's findings, immediately withdrew their funding. They cited a breach of material trust and redirected the new freight line to a rival town 30 miles to the east. The very economic salvation the local politicians had sacrificed their poorest residents to secure was instantly gone. The aftermath of the 1,895 census discrepancy was characterized by a profound and enduring silence. The local authorities never formally admitted to the cover-up. State political figures, embarrassed by the blatant fraud occurring under their jurisdiction, quietly distanced themselves from the town. No one was ever prosecuted for the deaths in the lower district. The unmarked trench burials remained unacknowledged, hidden beneath the encroaching pine needles. The town, denied its railway expansion, slowly atrophied. As the timber industry modernized and moved further west, the population naturally dwindled. By the 1920s, the lower Mill Pond district had been entirely reclaimed by the forest. The grand boarding houses rotted and collapsed, leaving only faint stone foundations hidden in the undergrowth, the only physical monuments to the phantoms who once filled the ledger pages. For nearly a century, the official story remained the one written in ink. The fabricated census of 1,895 sat undisturbed in government vaults, a perfectly preserved lie, accepted as historical fact by anyone who didn't know how to look for the missing pieces. But history is patient. In the late 1990s, a team of historical epidemiologists began re-examining the 1,895 state censuses to map the historical pathways of enteric fever. They applied modern statistical software to the digitized ledgers, looking for anomalies. The computer flagged the Northern Timber District almost immediately. The algorithms detected the impossible ratios of age, the clustered occupational errors, and the statistical improbability of a zero mortality rate during a known regional outbreak. This modern re-examination led historians back to the town's archives. It led them to the forgotten letters of Clara Hewitt, the desperate pleas of Dr. Vance, and the grim tally marks of Elias Thorne. Slowly, painfully, the true narrative was reconstructed, not from the official pronouncements of those in power, but from the discarded fragments left behind by those who lived through the silence. The 1,895 census discrepancy remains a chilling case study in the weaponization of data. It serves as a stark reminder that official records are not always objective truths. They are documents, authored by people driven by motives and susceptible to extreme manipulation. When a community's existence becomes an economic liability, the simplest solution for those in power is often just to erase the ink. Today, if you walk through the woods where the lower district once stood, there are no historical markers. There is no plaque commemorating the 142 men who died in the dark, legally invisible. There is only the quiet of the forest and the enduring, uneasy question of how many other flawless ledgers in the archives of history are hiding a similarly dark and silent truth.